We're going to have a little pause before we go on to the last speaker, Professor Sellermeyer, to have some discussion and questions. There's been a lot of talking by professionals this morning. I think what's really incredibly important is that there's a conversation amongst parents and families. So it's with great pleasure I'm going to introduce Susan, who's going to lead the discussion.
Yes, I just thought we'd see if anyone has any questions on anything that they've heard so far. Obviously, we've had a question about Queensland, but important.
Hi, I was wondering why 80% of Fontan patients are based in Melbourne, Sydney or Auckland regions. Is there a reason for this statistic?
So in Melbourne, we do the patients of South Australia as well. So 80%, that's the way it is. I think that Queensland started a bit later to do the Fontan historically, and that's why. And there is some things that look like a Fontan, but was not exactly like it, that were done until late in certain area, and that's why these are the numbers. So if you look at the population, that's how. The population historically has been distributed. That's the way it is.
Okay, thank you. Hi, my question is in regards to the randomised controlled trial studies that Dr. Eyre was just talking about. I was just wondering if there's a view for the statistics to become publicly available, possibly via the Fontan Registry website, or something for us parents to be able to have a look at when they are finalised.
I hope the systematic review will be published soon, and certainly, I think we could put the link to that. Sometimes it's hard to tease out the particular information you want from a systematic review, because essentially the process is to summarize a lot of information. In terms of the data for the outcomes from the Fontan Registry studies, I think they're always available. Eve, you can. I don't know if that was what you were referring to as well.
So the way we feed back information to you is we have a newsletter once a year. So it's very summarized. We try to have it one page, and we put the most predominant findings of the year. Then there's every year now, the first one was last year, every year we'll have a yearly report. And so we've just decided yesterday that the statistics about survival will be published then on there. And every time a manuscript or some research has been completed, normally if you're part of the research, so we try to give, and usually we have a letter that is being sent back to you at the end of the research, but it may take 3 or 4 years between the time you have the investigation and you have the results by the letter. And as soon as the document is presented or published, we try to put a little note in the Facebook page when some things has come out, and then we put the links into the Fontan Registry website, so you can hopefully access the full manuscript yourself if you want to.
At the beginning of the day, you were talking about some of the side effects, which is leg cramps, migraines, and from the Fontan procedure. I was wondering if anyone brought up anything about anxiety. It's 5 years post for our son, and he's got very bad anxiety.
I think it might be best to defer that very important discussion to when Nadine Kasparian presents in the breakout session, but also when Laura presents later in the day. It's a very important thing, and we've got some good stuff to address that.
Hello. I was just wondering how long it takes, like new treatments, to become relevant that you can pass, whether it's medications or other things, until you can get meaningful data, like what was presented earlier.
So when do you instigate a new procedure based on research? Is that what
Well, there's new drugs like warfarin, the next generations of warfarin coming through, and those things. So how long does it take for those new advancements to have meaningful data that can be relevant for this?
Okay. Yeah.
The good news is, if it's going to happen, it happens about the first in Australia and New Zealand. There is a surprisingly long time for drug development. So those new warfarin things, if anyone with a Fontan is going to get them, it's going to happen here first. But those drugs were invented 15 years ago. And it's taken 15 years because safety, it's hard to use. Everyone wants the drug, but safety is such an overwhelming concern. And the first two versions of those new warfarin things turned out to be very dangerous without anyone knowing until they were tested on humans. So the drug development time is very long, but that's to protect people. But the moment drugs become approved, our Australian regulatory system and the existence of the Fontan Registry here means we get them nearly first in the world.
And the lady up the very back.
Yeah, I just wanted to ask about migraines. Do you have any idea what causes the migraines, and how can we help people that get migraines? Because I've spoken to a lot of Fontan patients who say that painkillers don't help at all. There's nothing they can do, just let it go.
Judith, good morning. For our functional outcome study, which we're starting recruitment for in New Zealand very soon, we are looking closely at some brain MRIs. We're also going to be taking a close look at the prevalence of stroke and migraine. So we're going to be examining that in a lot more detail, and as soon as some more information is available, we'll share that.
Sorry, I want to make a comment about migraine. There's no evidence that treating migraine in Fontan is different from treating migraine in anyone. So there's an action plan for the acute migraine. There are preventive medications like standard migraine. And one of the really important things in the Fontan circulation is if there's a fenestration, which Professor Wimore spoke about, this tiny hole, there's probably a link between having a fenestration and a migraine. And if the migraine is unresponsive to anything else, and I've got to say 90% of migraines in Fontans can be controlled well, but if it isn't, you can close the fenestration by a very minor procedure, and that often fixes the problem. I'm not saying that people with migraines need that hole closed. There are lots of steps that you go through before, but there is a systematic approach to the control of migraines in Fontan patients, which almost always will give a good result.
And then the last question for now, the gentleman over there.
In the case of the randomized studies, it was stated neither the administrator or the recipient are aware of whether they're receiving the trial drug or the placebo. If there is a situation where perhaps a subject didn't respond to the treatment, but not knowing whether they've received the placebo or not, are they going back and analysing what they received to see if they just didn't respond, or are they just falling by the wayside?
All the researchers will want to get up and answer the question. This is a critical part of design of double-blind studies, where the researchers are able to analyse as they go through the study at particular key points to understand whether the treatments are being effective or not effective. I mean, anybody who participates in such a study can move out of it if they so wish, but it's important to remember that part of the reason for doing those studies is because we actually don't know whether the treatment is really effective or not. And Dr. Ayer was talking about that a little bit earlier in relation to ACE inhibitors. So we're still coming to understand some of those things. Does that answer your question? Sort of.
I think you are saying they do go back and analyse each case.
Oh, absolutely. Well, I mean, the cases, particularly what we want to make sure is that there's nothing adverse happening to people along the way that we can attribute to the study process.